dental implants, you also have your own school.
Thank you. Yes, I do.
And you teach this to American dentists.
We do. We take American dentists probably 3 or 4 times a year, and we train them how to place implants.
So you're the
Myself and
teacher,
3
too.
other faculty. Yep,
So
it's my school.
That's who you want to go to. You want to go to the teacher. So what's the time frame as far as if you're removing a crown per se and then you're having an implant? Can you take the crown off and immediately do the implant?
Yes, and I'm sure you've heard of the term teeth in a day, and that would be teeth in a day. So that procedure is done when you remove a tooth, place an implant, and then place a temporary crown or a temporary bridge that same day. And that can be done. It's not a final, but you will leave with a tooth that's fixed in your mouth that day.
Wow.
That was always the thing that bothered me is, do I have to leave without a tooth, you know?
I know. So what
Never.
happens if you have extractions? So some people may need, all their teeth taken out and have full implants. Can you also do the implants the same time as you do the extractions?
Yes, of course. It used to be, and in some cases it still is, where you have to do the extraction first, wait 3 or 4 months, and then place the implant, then wait 3 or 4 more months, and then place the crown. And there are still some situations like that. But typically now, we just do everything all at once.
Because I know that sometimes with people with dentures, they may do extractions and then they do immediate dentures.
Right. So
But
instead of
the
an immediate...
swelling, though, isn't there swelling within the gums?
The swelling is typically due to surgical trauma. So if you
Right.
have a nice, gentle surgeon, you should be all right.
Okay.
So, again, let's give everybody your phone number. It's 954-790-6687.
6867.
6867. This is the main number, whether you're calling from Boca or Delray.
So you can make an
Or Fort
appointment at
Lauderdale.
either location.
Correct.
And usually, what is the time from the time you make a decision to have the implants till it's actually finished?
It can range. The least amount of time is 3 months.
Okay.
So typically 3 months to a year.
But you're not walking around without any teeth, though.
You will always have teeth and you'll always be comfortable. And in most cases, you'll leave with something fixed, which means it's not removable. It's not a denture.
They have done some incredible things. You used to be able to tell if somebody was wearing dentures or not. But, there's a lot of people, like my sister has implants. You cannot tell.
No.
There is no way that I could tell that she has which one of her teeth
Well,
are
the
implants.
problem we were talking about dentures previously, and we were saying that the dentures, when you're chewing, they move, and
Right.
it's not that comfortable. So there's a major difference between having implants stationary in your mouth rather than just having something that's removable.
A denture is what we call tissue supported. And it is what it says. Basically, the denture is sitting on the gums. So imagine your lower jaw. Your lip is moving around. Your tongue is moving around. Everything is fighting that denture to come out. With implants, it snaps onto the implant or it's screwed into the implant and it just doesn't move.
Right,
And-
because typically you think that if you have dentures, you can't chew certain meats.
Right.
And with the implants, it's totally different.
There are no more sore spots, no more
Oh,
relines.
yeah, that's right.
Yeah.
I used to
On the
have.
gums, yes.
So, again, Dr.
So typically, let me just ask you another question. So do most patients need a bone graft after they have an extraction to support the implant?
I almost always recommend a bone graft after an extraction. And this is something that probably in the last 5 years, most doctors have caught on to. If you bone graft right after an extraction, you're a better candidate for an implant. Like I said, most people can be a candidate, but it'll make the surgeon's life a lot easier if you just took that one step when you did the extraction.
Wow, okay.
Is there a difference between the healing process between the upper and the lower?
Sometimes there is.
Because that's what I'd heard, that,
yeah.
that sometimes the healing process is different depending on if it's the upper or lower.
The lower jaw is harder. It's like maple or oak wood. The top jaw is almost like cork or balsa wood.
You're kidding.
So if you know anything about carpentry,
Right.
then
Which
you
I
know.
don't, so explain.
No, but I can
Okay.
tell. How would it be different, the upper versus the lower? That's
So the implant needs to integrate for a little longer on the top jaw where the bone is not as hard.
But isn't your sinuses are in your upper, obviously in your upper.
Good question.
So
yes.
how does that affect that?
I told her to ask that.
Did
Settle
you?
down. No, he didn't.
Well, the sinus is an air-filled cavity on the top jaw, for those of you who don't know what it is. And basically, you can't just put an implant into an air-filled cavity. That doesn't make any sense. It wouldn't be stable. So what we do now is we lift the membrane and place bone right into the sinus. And that integrates with the implant. It becomes hard, and it becomes part of you.
So what happens if you have sinus problems? I mean, does that affect anything?
Sometimes it does, yes.
Because I have very bad sinus problems, and that's why I'm asking that.
Yeah, we would have to put you on a Claritin or something like that beforehand, and also take a look at your sinus with either a CT scan or a panoramic X-ray.
Okay, so normally at this time we would do a commercial, but I want to do something a little bit different. Let's talk for the next couple minutes. Talk about some of your other services that you offer, because we just learned just now that you also offer Botox.
We do. Actually, we started getting into Botox because we treat TMJ.
Okay.
And when you're squeezing your jaw together, you clench that muscle there. If you inject the Botox into that muscle, the muscle relaxes and you don't have as many headaches and clenching.
Wow.
That's interesting.
But most of our patients would like it a little here, a little
They're
there.
coming for cosmetic
They're
purposes.
coming for the cosmetic
not for the TMJ.
purposes. Absolutely.
I'm going for the cosmetic purposes.
And tell us what other type of services you offer.
We offer veneers and crowns. We offer Juvederm and many other services. I mean, you name it. We pretty much have everything in between the two locations. We have many different doctors. So some doctors are great at one thing and some doctors are great at another.
And your specialty is implants.
Well, it's
One
not
of your
actually a specialty. But yes, I focus on implants and cosmetic dentistry and full mouth rehabilitation.
Tell everybody where your two offices are located. Do you have both addresses?
Yep. The one in Boca is 3401 North Federal Highway. So it's basically on Federal Highway, just south of Yamato. Okay?
Very easy to find. I
Very
found it.
easy to find. And
If he found it, it's easy.
the other one in Fort Lauderdale is 3343 Northeast 33rd Street, and that's right off of Oakland Park Boulevard. When you get to A1A, you make a left, and it's on 33rd right there. Right by
know
one of your
exactly.
favorite restaurants.
Yes. we
And give
know
everybody
exactly what
the
that's-
main phone number once again.
The number is 954-790-6867.
And just remember this again. You know, when people decide they, especially cosmetic dentistry, a lot of people don't go to just a general dentist when it comes to cosmetic dentistry, because this is what you deal in. This is, especially dental implants, you do this every day.
This is her expertise.
Exactly.
A lot of dentists will be stumped when they see a case that really needs a full rehabilitation or cosmetics. So you do want to go, whoever you decide to go to, needs to be somebody who's very comfortable, who does this on a daily basis, who's gone through all the trials and tribulations and knows what to expect and can explain to you what to expect.
Do you offer free consultations? Can somebody come in and just discuss it with you if they're interested in having implants done?
Yes, we have a free implant consultation, and you can just call the number 954-790-6867, and you can schedule it there.
What happens if somebody needs an implant in the front of their mouth? So they're not going to go toothless. So this is everybody's fear, because you don't want to walk around. You know, if you're missing a tooth in the back,
Right.
you know, no big deal. You can't really see it, but people are very conscious of that. So what happens? What can you do to eliminate that fear?
That's actually our number one emergency. Somebody broke a front tooth.
Yes.
So they come in and we remove the tooth, place the implant, and place the temporary crown the same day. So that would be the tooth in a day. You leave with a tooth. Now you have to be on a soft diet and you have to follow special instructions for that, but you will leave with a tooth. If you don't want to have a soft diet or anything like that, we have a laboratory on the premises, and we can make you a flipper or something temporary that is removable that same day.
Oh, that's really
So
important.
explain to people what a flipper is.
It's like a retainer, but it has a tooth attached to it.
So it actually snaps onto your additional teeth,
Yes.
on the other teeth.
And that would just be temporary.
Now, you said emergency. I mean, can people, let's say I've got a big meeting tomorrow and I broke my tooth right up in the front. Can I call your office after hours?
100%.
Wow, I love that.
Yeah.
So you would come in, like if we had to film and I lost a tooth.
That is
Keep a
what I
card.
consider an emergency. If you break a back tooth, it might not be as much of an
Yes,
emergency
of course
as a
not.
front tooth.
Right.
Yeah.
Absolutely. Can somebody be allergic to an implant?
That is not typical. There only have been probably about 5 cases reported. And as long as the surgeon is using a good quality implant, which is very important, you should be just fine.
Okay.
It's
and what,
titanium.
And what is the tooth made? Oh, it's titanium. Is that what the tooth is made of?
The implant is titanium, and the crown that goes onto the implant, the actual tooth-looking part, is porcelain or zirconia.
Mine's made out of wood.
Okay, so let me just ask you
Oh,
something.
What type
cheap.
of wood? Balsa or oak?
So there's different types of implants also because you're talking about doing individual teeth, but is there like an implant that you just put almost like a denture that snaps onto the implant itself that's in your
A really
bone?
good option for somebody who already has a denture and just wants something a little bit more stable is basically 2 implants on the bottom, and then the denture snaps onto it. And it's a low-cost way to make you comfortable.
And that holds that in.
Yep.
It will hold the denture in. So instead of having to get glue and have to whatever fix a dent,
No,
you don't
more
have
of
to
that.
do
No,
that.
Not at all.
Wow.
So again, this is really. Please believe me. You don't want to just go just to anybody. I mean, I've actually seen now a lot of dentists. They just stick that shingle up there. We do dental implants, and they really don't do a lot. And if I'm going to put that kind of money into something, I want someone who is really good at what they do,
Of
who
course.
does a lot of them, who has their own school. I mean, I want to go to the best. So if you're listening today, you know what? It doesn't cost you anything to go
Or
in
if you
for
have
free
dentures and you're
consultation.
uncomfortable with the dentures, there are other options. You don't have
Right.
to live like that for the rest of your life.
It's a free consult, and basically, it's worthwhile to just come in and be educated.
See what
even.
your options are.
See what your options are.
I would think that would be one of the best investments to make.
It
Because
is.
you eat throughout the day and at least you could be comfortable
You know,
chewing.
A patient of mine just came in and is so happy with the restoration that she got, 4 front teeth in the bottom. And her boyfriend is the one who paid for everything. And he said that that was a better gift than buying her a diamond.
Wow.
This was yesterday.
Renee's going, don't get any
I'm
ideas.
trying to weigh it. I'd rather have the teeth. I'd rather be able to eat. I like to eat.
So I wanted to save this. This is going to kind of surprise Dr. Herzog again. So I'm sitting in your lobby waiting to see you. You had 3 or 4 patients in there. And they're starting to talk to each other. And they were all men. I don't know why that was that day. They were all men. But
Because she's so pretty.
so one of the guys was going, some guy said, did you have dental implants? He said, yes. Did you? He said, yes. 2 people at the same time. And he said, I love mine. He said, it has changed my whole life.
I would imagine
The guy's
so,
going,
yes.
yeah, I never knew it would change my life like this. It's like you
It's
the name of
very
your practice,
comfortable.
Lifestyle Dental.
It does. It changes your life. It's very comfortable. When we deliver a case where a patient lost all of their teeth and had to have one of those teeth in a day with all of their teeth done, they cry. I mean, I have videos of the patients crying because they're ecstatic with the way their life has changed.
I know.
That's amazing.
It is.
And
And
it's a huge transformation.
You've got such great information on your website,
Thank you.
www.lifestyledentalgroup.com.
And I heard the term 4 on the floor. So what is that?
4 on the floor is basically 4 implants on the lower jaw and a bridge that connects from one to the other. So it's all of your teeth replaced with 4 implants, and it doesn't come out ever. Only the dentist can remove it. It's porcelain and beautiful.
Wow.
Yep.
What are mini implants? Is there a difference?
We hear that so often.
Well, mini implants are controversial,
Uh-oh.
and
Leave it to us.
I typically use them only as a temporary measure, and I later replace them with a traditional implant. Mini implants are very low cost, and they're okay to get you by while you're doing bone grafting.
So
Funny
mini
that
in my
implants.
commercials
opinion.
don't say that.
So wait
by
a
other
second. Mini
dentists.
implants. So are they smaller than the actual regular implants that you would use?
A mini implant is about 2 millimeters. It's very, very small. And so a traditional implant is 4 or 5 or 6 millimeters even. It's a big difference.
So you wouldn't recommend that?
In some cases where you have no other option, it's okay to go with the mini. Otherwise, when I remove them in surgery, I actually just do it with my finger pressure. So I typically
Wow.
don't, and some doctors might get mad at me for saying this,
Well,
but I
there's a
typically
national-
They're
do
not as
not.
obviously not as sturdy as
No,
getting
I
a
don't
larger
teach
implant.
mini implants, and I don't advocate them.
Okay, so 'cause the reason why we brought it up is there's a national company all over the United States, and their TV ads, which you guys are paying for, trust me, their TV ads talk about mini implants, how great they are.
So we're just hearing that they're not.
Exactly, but that's what they're pushing, though.
Right, because obviously that's the less expensive way to.
They're not
to go.
expensive. They're easy to place for a surgeon, so typically it's an easy procedure to do, but it's a temporary procedure in my eyes.
What is a hybrid denture?
It's not a car, right?
Is it a car? I actually
There's
own
a
a
hybrid
hybrid
car, yes.
car. Okay. A hybrid denture is 4 on the floor, basically, but it's made with acrylic teeth on top. So it drives the price down for the patient. It allows them to have something fixed, permanent in their mouth without removing it with just 4 implants.
So you have so many different options.
Mm-hmm.
That's why it's really important to come in for a consultation, discuss that, whether you have insurance or you don't have insurance. I mean, this is actually such a worthwhile thing to do because it does change your life, having the implants.
Can implants ever fail?
Implants can fail.
Oh, they
Yes.
can? Yes.
They do have about a 95% success rate.
That's good enough for me.
So they're better success rate than a root canal. But they can in some cases. And usually it's with somebody who's compromised health and things like that.
So in what respect? Maybe come out?
Yep.
Okay.
Rejected. But usually it doesn't happen.
But
It's
that's not
very
typically
rare.
the case.
No, it's not typically.
Is there much of a downtime after you've had the implants?
It's about the same as an extraction.
Okay.
So maybe if you have them done on a Friday, by Sunday you could be out at the mall walking around.
Swelling? Is there swelling afterwards typically? Or?
Usually not, unless you're doing a very large surgery. And in that case, we just pre-medicate with a steroid, and then you won't have the swelling.
Wow, it sounds
You know,
perfect.
I know. Well, now people have learned to. There's a lot of options. We have someone right here in studio. It's called LifeStyle Dental.
Give your
Group,
website again.
It's lifestyledentalgroup.com.
that we have someone right here. Listen, you should call them today. Call them tomorrow.
Even just go in for a free consultation
Right.
if you're thinking about doing
And see
it.
what your options are, because trust me, it absolutely changes your life.
How long typically is the procedure to do the implants?
One single implant usually takes me about 15 minutes.
That's
And you do it with
quick.
your eyes closed, hands tied behind your back. It's
If we're
nothing.
doing a very large procedure, we can do it computer guided. So I can basically do the whole surgery on my computer. And when you come in, it'll only take me an hour, even if it's 6 or 8 implants.
Wow, that's amazing. That's incredible technology.
It is
All I
great
know is
technology.
everybody in your waiting room, I guess, do you come back for follow-ups? Is that what people do?
You do. I
How
actually
often?
follow up closely with my patients. Unfortunately, half of our patients are snowbirds, and so we do. We do talk with the doctors back in New York or Connecticut or where they're from. But
What's
I
the
like to
recommended
follow
time
up
frame to have somebody come in for a follow-up?
1 week, 3 weeks, and then 3 months.
I think that's what all these men were doing, waiting in the waiting room.
So do you have to continually come in, maybe yearly or 6 months?
Yes. So you'll have your maintenance. Basically, you'll have your cleanings, and that will take care of the implants as well.
Give your phone number once again.
It's 954-790-6867.
Wow, it went by so fast. I had all
did.
these
Is that
other
it?
Yes.
I
questions.
can't believe it.
Yeah.
I know, it's amazing. Listen, thank you for coming on today.
Thanks so
welcome.
much.
I know our
Anytime.
listeners are going to love this. And hey, we're going to be back on Friday from 4 to 5 with more experts. Everybody have a wonderful week. Without you, there is no us. Peace and love.
We're out.
Thanks for tuning in today to the Ask the Experts show with Steve-O and Renee. Tune in every Friday from 4 to 5 p.m. while some of the top local experts in their field from Broward and Palm Beach counties educate you in the areas of law, health, financial, and home improvement. You can also call our offices at 888-574-6999 to become an expert on our show. The opinions expressed on the